Any answer from the nurses? Hmm? Okay, I'll tell you. Scene safety in the sense, for example, you might be traveling, okay? You've seen a person on the road, he collapsed. There itself, we cannot give the CPR, right? Because we have to see the safety of the person who is being collapsed as well as safety of yours also. So for which reason what you have to do is, you have to bring the person to the safe position. And not only that, you need to keep the person not on a table. You have to see that a foam surface, okay, like a floor anywhere. Because if you are placing in that way, in the sense, when we are giving the compressions will be directly delivered to the heart, so that the heart can pump the blood. Okay. One scenario is, I told you, maybe might be in a traffic area, which means we are looking for the safety of the patient as well as safety of ourselves. Or else you see the person in the lift. In the lift itself we cannot give, right? We make sure bring the person to a place where people who are not well crowded, and there you need to give the compressions. Is it clear? So examples coming same way. Might be in a hospital also, you see a place, a crowded place also, see that a place where much crowd is not there, so that no one will disturb there. So the first one is check for the scene safety. As I said, BLS stands for the basic life support. In this, after checking for the scene safety, what is the next one? Check for response. How do we check for the response? Do you have idea? Tap the shoulders. When you are tapping the shoulders, it should not be in a low voice, because you have to be shout. Hello sir. Hello ma'am. Okay. Sometimes what happens is, in case let's say you are in any of the department, if they are not responding, we can also give by stimulating the pain at the collarbone, where your knuckles will be there. Like this you can place and you can give the pain. Okay. Some people who are unconscious, this is to make sure that whether the person really require the chest compressions. Okay. Some people might be fallen due to the glucose, if they are having a low glucose or it's a low BP. So to confirm that, what we are doing is whether the person is awake or not, we are checking out. So checking response in the sense, not in a low tone, higher tone. Okay. It is a male or female. Hello sir. Hello ma'am. Okay. This is the second step. First, as I said, check for scene safety. Second, check for response. Then third step,
check for the pulse.
Check for the pulse. When you are checking for the pulse, you can see, you can use either your 2 of the fingers or 3 fingers, where you can see this is the area. And the thing is, you should not check for 2 things at a time, because a person who is having a cardiac arrest, already blood supply is not there. This blood supply has to, when you're pumping, it will be pumped to the brain. Okay. When you're checking the with 2 hands, we are blocking the blood flow. For which reason you have to check for one side. When you're checking, you can feel it. At the same way, here you have to look for the chest rise. You can look for yourself. When we are breathing, our chest will be rising, or else your abdomen will be rising. And even when you are breathing, we'll be having, if you keep your fingers near to your colleague or your friend, we can feel the breath from the nostrils, right? And when you're checking the carotid pulse, just move towards the head, and then when you're checking, what you have to do is, let's say, bend your head like this. At this time, here timing is there to check for the pulse. What is the timing? Can anyone tell me? It should not be timing is 10 seconds or minutes? Seconds. Because here time is very important, because the person is losing the life for which in 10 seconds. So it should not more than 10 seconds. It should not be less than 5 seconds. Okay. When you check this, what you have to do is just bend your head. Okay. And then you can check for the chest rise or else the abdomen rise. At the same way, you can feel, in case if a person is breathing, you can feel the breath on your cheek. Got it? So your given time is what? It should not be more than 10 seconds, not less than 5 seconds. So for which reason what we are doing is we are checking, and beside that, to save the time, you can bend your head and then check out. One way you can feel if a person is breathing, you can feel the breath on your cheek, or else you can feel whether the chest is rising or not. This is the thing, okay? What is the next step? How many steps we have completed? One is check for seat safety, check for response, check for pulse, and in this only see that whether the chest is rising or not. We are having a timing in this one. And what is the fourth one? Huh? Will immediately start for CPR, or you don't call for help? So what we have to do is, if you have checked in nowadays in the shopping malls or else in airports, we'll be having a AED. What is meaning of AED? Automated electrical device, where automated electrical device where you're going to place it, and it will be electrically sensing, and then it will deliver the shock to the heart. Okay, and we're going to place it here. So AED, what we're going to call for the help. So while you're calling for the help, you're going to say it as a get me AED, call for ambulance. Okay, what's the best thing here is you have to point out saying. One is what you're pointing. Let's say a group of people are here, right? I just tell that get me AED and call for ambulance means everybody thinks that okay, someone else will go and bring the AED or call for ambulance. But when you point out, it means that a person is being responsible. Okay, so you're going to point out saying get me AED and call for ambulance. Once you do that, what we do is we're going to start the CPR. In hospital also, before the code blue team arrives, we will start the CPR to save the person life. So generally it is not possible to do on this one. I'll show it in the down. But for a theory purpose, I'll tell here only. So what you have to do is, whatever your dominant hand is there, you keep it here, okay? And then lock it. See that the heel of your hand is placed. Make an imaginary line, okay? This is the both of the nipples. In center of that, what we're going to do is we're going to place it, okay? Lock it. And one more thing is this elbow should be straight, and the compression which you are giving, it should completely come from the shoulders. Okay, you have to kneel before the patient. Sometimes at the hospital bedside, what they do is they'll climb the bed, or else they will lower the bed size. But BLS means what? Basic life support. If you see anything with your colleagues or within your departments, these are the steps you have to follow. You have to start the CPR. When you're doing that, the most thing which you have to remember is see that your elbows are straight. When you're doing, it should not bend like this. Okay, I'll show it in the down. Okay, when you're doing what, it has to be straight, and your hip should be straight. Okay, and whatever the pressure which you're giving, it should be come from the shoulders, so that the effectiveness will be there when we are doing the CPR. Okay, so CPR compressions are there. These compressions you have to give how many compressions? 30 compressions, 2 reps. Okay, in case if there are 2 risk givers, what we do is we're going to give 15 compressions. Okay, and then only one person is there means we're going to give 30 compressions and 2 breaths. And besides, when you after do the breaths, how you will give is you're going to lift the patient. Okay, in case if a person is having a trauma, any spinal cord injury, anything is there means what we do is jaw thrust manual. What we do is with this jaw we're going to lift it out, and then with the ambu bag, especially when you are holding the ambu bag, see that we'll be having a C and E technique will be there. Okay, this I'll show it in the ground. I'll call 5 people and then I'll show it. Okay, so coming to steps, I already told you 5 steps. What are the 5 steps? Check for scene safety. In scene safety, whichever the area, make sure we are making the person to keep in a nearby place where there is no much crowded. We are saving the person as well as protecting ourselves also. In the middle of the traffic road, we cannot give. In the lift, we cannot give. Or else in a swimming pool, if a person has fallen, we cannot give CPR there. Or else in the steps, we cannot give. So for which reason, see that you are giving a scene safety an area. And then followed by second one is what? Check for response. How you check for response? Tap on the shoulders. Hello sir, hello ma'am. Okay? And then if you know the name, you can call it. What is the third step? Pulse. When you're doing pulse, what I said, we're having a timing in this one. It should not be not more than 10 seconds or not less than 5 seconds. And when you're doing that, slightly bend your head and check out whether there is a chest raise is there or not. Next is what? Call. Especially when you're calling for help, point out saying what? Get me AED, call for ambulance. So that a particular person in the group will be taking the responsibility. And when we start the compressions, we are having a compressions, 30 compressions and 2 breaths. And especially when we are holding this one, we'll hold with a C and E technique. Okay? So this theory completely applies practically. So here every person will be coming forward after I do and you will tell me, okay? So the main concept is what? How effectively you are giving the CPR. Is it clear? Okay. Any 5 members come forward. It is like this, right? You have to lock it and see that air is not locking and both nostrils and the mouth, and then you're going to give breaths. 2 breaths you're going to give, okay? 2 breaths you will give. In case if you have a handkerchief, that also you can place it here and then you can give it, okay? That is done on the outside, okay? But if you're inside means, what we do is, see that, I told you that C and E technique. This will be coming on the nose ridge, okay? Place it here and see that it is not going below the chin. Because if it goes below the chin, the air will, there is a leakage. Okay, and then what you do is these remaining 3 fingers will be at the below the jaw level. You will hold like this, and then what we do is we are going to keep it. Here the main reason is C and E technique is specially to prevent the leakage of the air, and then slightly lift it. Okay, the trachea will be in a closed way for which we are going to lift the person, okay? And then if you see the lungs, what is the lung capacity? Oxygen, tidal volume, who are working nurses, it will be 500 ml. But whereas you see this one, some ambu bags will be there for the 2000, 1500, 1000 ml will be there. So will you do like this, or else you just give one will give, okay? So lift the jaw slightly and then see that your chest is rising here, okay? You are giving only 2, okay? 1 and then 2. This is the method. And especially if you got a doubt of outside it is not followed, we go with the either locking method or else use any barrier cloth, okay? So I'll be expecting one of the other to come forward. Remaining can stand. You can stand. This sound should come. Adequate push, adequate chest recoil. You have given an adequate push, okay? And when you're leaving, that has to be recoiled, okay? And in 1 minute, you're going to do.
It was man. So hello sir. There is no response. So immediately I was checking the carotid pulse. It was there.
Any one side.
I'm seeing it left side. At the same time, I'm seeing the chest is raising or not. And I'm seeing that I can feel that breaths or not. There is no pulse and there is no chest raising. So I call for help. Just take areas and call for ambulance. And I'm starting CPR. So heart and pulse, minimal interruptions, and immediately shift rolls. So I'm starting the CPR. 4, 5, 6, 7,
15 is enough.
15. Immediately, and anyways, help will come now, sir.
Since no one is there, you show with the ammo bag also. You can come towards the side. Okay, great.
Head tilt and chin lift. We
Hmm.
want to see the position so the trachea easily the air will go to the lungs. So I'm doing the E technique.
C, head tilt and chin lift.
Chin lift. So I'm giving only I did 15 compressions, so one breath. Just
Okay.
I did it.
No.
Next.